Good day everyone, and welcome. In this session, we'll be discussing larval migrans, a group of parasitic conditions that are important not only clinically, but also from a public health perspective, especially in tropical and subtropical regions. Larval migrans occurs when parasitic larvae infect humans accidentally. Humans are not the natural hosts, so the parasites cannot complete their life cycle. Instead, the larvae migrate through tissues, causing inflammation and disease. There are two major types that we need to understand clearly: cutaneous larva migrans, and visceral larva migrans. We'll explore each one separately, along with the key learning outcomes.
Before diving into the types, it's important to remember one key concept: larval migrans is a syndrome, not a single disease. It refers to the migration of nematode larvae in human tissues, leading to characteristic clinical manifestations depending on where the larvae migrate. If the larvae stay in the skin, it is known as cutaneous larva migrans, and if they migrate to internal organs, it signifies visceral larva migrans.
Let's begin with cutaneous larva migrans, the more visually striking form. Cutaneous larva migrans is a clinically and parasitologically defined syndrome caused by subcutaneous migration of nematode larvae, particularly animal hookworms. It is also commonly known as creeping eruption, sandworm eruption, plumber's itch, and also hookworm-related cutaneous larva migrans.
Cutaneous larva migran is defined as a skin infection caused by larvae migrating within the epidermis. The most common causative agents are animal hookworms, especially Ancylostoma caninum, Ancylostoma brasiliensis, and Uncinnaria stenocephala. These parasites normally infect dogs and cats, not humans.
Transmission occurs when infective falciform larvae penetrate intact human skin. This usually happens through walking barefoot on contaminated beaches, sitting or lying on sand, or children playing in sandboxes. The soil becomes contaminated by dog or cat feces containing hookworm eggs, which hatch into infective larvae.
Once the larvae penetrate the skin, they cannot migrate deeper. Instead, they move laterally within the epidermis, releasing enzymes such as proteases and hyaluronidase. This causes a strong inflammatory response along their migration path.
Clinically, patients experience intense pruritus within hours, erythematous papules at the entry site, and also a classic creeping, serpiginous tract, usually 3 mm wide and up to 20 cm long. Common sites include feet, buttocks, and thighs. Secondary bacterial infections may occur due to scratching.
Although CLM is a self-limiting disease, treatment is recommended to relieve symptoms and shorten disease duration. Treatment includes oral albendazole or ivermectin, topical anthelmintics, antihistamines, and topical steroids, also antibiotics if secondary infection occurs.
Now, let's move on to visceral larva migrans, which is more systemic and potentially serious. Visceral larva migrans is caused by the migration of nematode larvae through internal organs, triggering inflammatory and immune-mediated damage.
Visceral larva migran is a systemic condition in which larvae migrate through organs such as liver, lungs, heart, brain, and eyes. The most common parasites responsible are Toxicura canis from dogs and Toxicura cati from cats. These parasites are among the most prevalent zoonotic helminths worldwide.
Humans become infected by ingesting embryonated eggs, usually through contaminated soil, poor hand hygiene, or close contact with pets. Children are particularly at risk due to behaviors such as pica.
After ingestion, eggs hatch in the small intestine. Then, larvae penetrate the intestinal wall. They migrate via the bloodstream to various organs. The immune system responds with eosinophilia, granuloma formation, and chronic inflammation.
VLM is often asymptomatic, but when symptomatic, it may present with fever, cough, wheezing, hepatosplenomegaly, lymphadenopathy, skin rashes, and pruritus. Long-term complications include asthma and pulmonary fibrosis. Human toxicariasis can present as visceral larva migrans, ocular larva migrans, leading to visual loss, neurotoxicariasis, causing meningitis or encephalitis, and also covert toxicariasis, with non-specific symptoms.
Treatment includes albendazole as the drug of choice, and corticosteroids to control inflammation. Prevention focuses on deworming pets, controlling stray animals, public education and hygiene.
To conclude, cutaneous larva migrans affects the skin, causing creeping eruptions. Visceral larva migrans affects internal organs, often silently but with serious consequences. Both conditions remind us that human health is closely linked to animal health and environmental hygiene. Thank you for listening.